In this video, we will learn about the preparation and equipments that are needed for intubation and the role of a nurse to ensure that all those equipments are working properly. The use of each equipment in the process of intubation is explained for better understanding. On that note, let's get started. As a standard procedure, first of all, do not forget to take consent for intubation. IV cannula. Check the patency of the IV cannula or the central line available for pushing the medications during intubation. If there is any block, place a new IV line for use. Laryngoscope. Laryngoscope is used to expose the laryngeal inlet under direct vision or line of sight to facilitate placement of tracheal tube beyond the vocal cords. Check if the blade fits properly with the handle. Check if the light source is working properly even when the blade is stretched. Make sure that there are no jiggly parts in the laryngoscope. The laryngoscope should be sturdy. Ensure that the bulb is tightly screwed and not jiggling. Keep 2 extra pairs of laryngoscope batteries with you, which may be useful in case of emergency. This is laryngoscope handle. This curved blade of laryngoscope is called Macintosh. This straight blade of laryngoscope is called Miller blade. Keep different types and sizes of endotracheal tubes ready like cuffed, uncuffed, subglottic and any other type of ET tubes as advised by the doctor as needed. By opening only a small portion of the wrapper of the ET tube, check if there is any leak of ET tube cuff. Keep a xylocaine jelly ready, which is used in a few hospitals to apply at the tip of the endotracheal tube for lubrication before passing it into the trachea. 10 ml syringe to inflate and deflate the ET tube cuff when required. Ambu bag for ventilating the patient. Ambu bag and mask should be attached to an oxygen source. Different sizes of ambu masks which are useful for pre-oxygenating the patient. Bougie, which can be used as a guide wire to easily advance an endotracheal tube into the trachea. Stylet. Stylet is an instrument which can be used to change the shape of the ET tube the way we want. Stylet can be used to easily pass the ET tube into the trachea in case of difficult intubation. Capnometer. Capnometer displays the concentration of carbon dioxide in exhaled air. It helps in confirming the position of the endotracheal tube. Loaded and labeled syringes of medications which are used during intubation like rucronium, vecuronium, fentanyl, succinylcholine, propofol, etc. We must also keep loaded and labeled syringes of emergency drugs ready during intubation, which will come in handy in case of emergencies. Apparatus for suctioning like suction set, suction catheters, normal saline or sterile water, central suction apparatus or portable suction apparatus are necessary to clear secretions and to maintain patency to increase oxygenation during intubation. ET tie. ET tie for securing the position of the endotracheal tube. Dynaplaster. Dynaplaster is used to secure the oral airway. But in some hospitals, dynaplaster is used in place of ET tie for securing the endotracheal tube. Keep a stethoscope ready for checking the bilateral air entry. Make sure to arrange personal protective equipment, that is PPE, like cap, face mask, gloves, gown, etc. for you and all others involved in the intubation process. Keep ready different sizes of laryngeal mask airway and a tracheostomy kit with different sizes. These can be used in case of failure to intubate with the endotracheal tube. Keep a calibrated mechanical ventilator ready with its hosepipe tips properly fitted in its oxygen and air pressure ports, and make sure that the power source for the ventilator and syringe pumps is working properly. Keep the ventilator tubings, catheter mount, servo guard, HME filter ready so that we can connect the endotracheal tube to the ventilator after we finish intubating. Oral airway for use if you suspect the intubated patient may bite the endotracheal tube. Employing nasal oxygen using a nasal cannula during intubation can prevent hypoxia. It extends safe apnea time and improves first pass success attempts. The time period between becoming apneic and oxygenated via intubation is a vulnerable moment in the patient's oxygen status. This suspected hypoxia can be possibly be reduced by using a nasal cannula. Magill forceps. Magill forceps are used to guide the endotracheal tube into the laryngeal inlet during nasotracheal intubation or a nasogastric tube into the esophagus under direct vision. It is also used in the removal of foreign bodies during intubation. Keep all the colored dustbins within reach to discard the waste. Rails tube. Placing a rails tube can prevent aspiration if we do not know when the patient last had food. Try to label each equipment clearly with capital letters so that it is easy for you to pass each equipment to the doctor who is intubating according to the sequence of steps involved in the process of intubation. So these are the equipments and preparation that you need to follow before intubation. If there are any other equipments that you use and any other preparation that you do other than this, please comment below. If you like this video, don't forget to hit that like button. Thanks for